When I first joined this Innovation Academy, I expected to learn about AI, entrepreneurship, and financial aspect of medicine. What I did not expect was how much it would change the way I think about medicine itself. As residents, we spent years learning how to diagnose, treat, and care for the patients. But this program reminded us that medicine is not only about practicing within the system, it's also about improving the system.
Through this program, we have been extremely fortunate to be exposed to interdisciplinary collaboration, design thinking, model building, patents, inventing new ideas and new technologies, using artificial intelligence to adapt solutions and manage existing problems. And really, we have learned to work together, communicate with each other, and build innovations that will improve patient care.
Participating in the Innovation and Entrepreneurship Academy this year has been a really transformative experience for me. I think probably the most significant way in which it sort of changed how I think about things is helping me go from a more clinical mindset where everything is very regimented and has to be perfect all the time to a more creative and innovative mindset.
One of the things I found most valuable was hearing from innovators about the times that they failed as well as the times they succeeded. We are very used to failure and success in medicine, and so hearing about these things in the entrepreneurship side, about how to fail and how to succeed properly, how to learn from your failures and learn from your successes, I think was really valuable for me.
One of the skills I developed was learning to translate clinical frustration into a structured innovation process. Through product development discussions, stakeholder analysis, and testing the product itself, we also learned how to identify which people are important in our product development: business analysts, tech-savvy bioengineers, etc.
People are almost always willing to help and push you in the right direction. And even though curiosity can initially drive your interest in a project, it really takes people and resources to make it manifest itself.
The most valuable skill that I developed was learning how to evaluate my own ideas objectively. So through the eyes of an innovator and an investor, not just as a physician. We are usually very close to the problems that we see, so everything feels more urgent and solvable. And I think this program taught me how to critically assess whether an idea has real potential and how to build a business plan around it, and what actually we need to do to move from a concept to the final product.
Participating in the Clinical Innovation and Entrepreneurship Academy has truly been the highlight of my final year of clinical training. Two of the most memorable parts of the program were the sessions on healthcare finance, which helped me understand how new technology must bring real value to a practice, and the early exposure to Mayo Clinic platform, which showed me the power of data and collaboration in shaping the future of healthcare delivery.
I've definitely grown personally and professionally because it really helps to think in a systematic process, and the power of making the connections and power of having the team support to get your ideas from just being an idea to completion.
And so I'm very thankful for the wide breadth of exposure that we got throughout this entire process. And I'm confident that when I stumble on my next big idea, I will be able to understand the process and take concrete, actionable steps that help move that process along.
Hearing about all the amazing ideas and projects that everyone's involved in, I think that the environment that you're in, supporting new ideas, innovation, collaboration, has really left a big impact on me and shaped the way that I'm thinking of moving forward with my career. You know, from all these experiences we've had, the sky's really the limit. And again, if you can imagine something, then you can make it happen, as long as you're working with a good team and, you know, you have a compelling problem that needs to be addressed.
And Dr. Elsabat gave me some very good advice one time. He said that artificial intelligence and AI is not going to replace doctors, but doctors who use AI will replace doctors who don't. And I think that's one of the main reasons that I think all physicians should have some foundation in innovation and entrepreneurship, because it's not only about the technologies, but it's really about giving the patient the best chance possible to improve their outcomes and to have the best outcome possible.
Personally, this program made me more adaptable, collaborative, and forward-thinking. As a future infectious disease attending physician, I now see my role not only as providing patient care, but also as helping shape healthcare systems and integrate emerging technologies into medicine.
I moved beyond theoretical brainstorming to see how medical devices are actually manufactured and tested for reliability. I have learned to look at an anesthetic machine and see manufacturing standards, reliability testing, and regulatory hurdles behind them. This transition from users to technical evaluator has been the most impactful lesson of my training.
During this program, I was able to move several of my own projects forward. This includes a collaboration with the Zumbro Valley Medical Society and the medical school's street medicine program to launch a PM&R volunteer outreach clinic in Rochester.
It's changed my views as a clinician to make it feel like I really can be both a clinician and an innovator. And particularly to my clinical practice, I'm always now looking for things to innovate, things to change, things to improve on.
As I think about my future career in medicine, in cardiology, I know this experience will continue influencing the way I approach my research, especially incorporating AI, quality improvement, and especially because I will be going into a field with a lot of interaction with industry. So a lot of this knowledge and the background I gained will be extremely important and valuable once I move ahead with my training.
This experience has been transformative. Moving forward, I see myself integrating these skills into my career, helping develop solutions that are not only clinically meaningful, but also practical, scalable, and impactful for patients and health systems.
The most impactful thing I learned this year was that innovation starts with understanding a problem, not solving it. I came into the program thinking innovation was just about generating great ideas. Instead, I learned the importance of deeply understanding the people you're trying to serve, questioning assumptions, and validating problems before investing time and resources into solutions. I think looking back, the greatest gift that this academy gave me was not one specific tool or framework. It was helping me discover a passion that I didn't know I had, but will now take with me throughout the rest of my career.
The point of innovation is all in all to help people. I am very happy that I signed up for the academy. I learned so many things.